We have some types of breast lifts, let me get that out, that I want to tell our viewers about quickly. Let's talk through these.
So the periareolar lift is basically, sometimes it's called the mini lift or the donut lift, and it's basically a lift that is done completely around the nipple, around the areola. So the resulting scar is a circle. It's a perfect circle around the areola. This is for when the breast has a little bit of droopiness. As the breast droops more, then you might have to do the vertical lift. It's sometimes also commonly referred to as the lollipop, and that removes a little skin in the vertical direction as well as lift the nipple. And then once the breast has gotten to a significant degree of droopiness, then you have to do the inverted T, which also adds removal of skin in the lower part of the breast. And this really makes the lift a lot more longer lasting.
All right, we have some before and afters that I want to share with my viewers and Lisa, who is tuning in. So let's see here. Well, there's a dramatic change right there.
Right, so you can see where she would fail the pencil test on the left. In the before picture, she has probably about 50% of her breast overhanging that fold. And as I mentioned earlier, that fold is the foundation of your breast. The more breast is hanging over that fold, the more likely you need a lift, and the more likely it's going to be one of the larger lifts, like the vertical, the lollipop, or the inverted T. In her case, I did a lollipop with a small implant, again, to give more of that fullness on top and that cleavage that a lot of people are looking for.
And do you have to reposition the nipple there, doctor?
Yes, absolutely. In most lifts, you are lifting and repositioning the nipple.
Okay, but there's no danger to that?
Well, there are potential risks, and of course, I discuss those all with my patients. You have to, of course, take into consideration the blood supply to the nipple. You know, a lot of people think that because there's a scar around their nipple that I'm actually cutting the nipple off and then like pasting it back down. But when in reality, the nipple stays connected to breast tissue underneath, and I free up that breast tissue so that I can lift it and put it where it needs to be. But I need to know that the blood supply is going to keep that nipple healthy, because it can actually have some healing complications.
And here, the dramatic change you can see also.
Right, so there's another patient that she had also a significantly more droopiness, and in her I actually did the inverted T, so I had to remove some skin in that lower fold of the breast to really give that breast a nice uplift.